Welcome to Penrose Learning, where we make understanding easy.
Cleanse gently twice daily with lukewarm water using a mild, pH-balanced cleanser to remove dirt, oil, and pollutants without stripping skin lipids. Pat skin dry and apply a hydrating serum containing hyaluronic acid, then follow with a moisturizer suited to your skin type. Apply about 1/4 teaspoon of broad-spectrum sunscreen, SPF 30, to the face each morning, and reapply sunscreen every 2 hours when outdoors and after swimming or sweating to maintain UV protection. Introduce active ingredients slowly and monitor skin response. Use chemical exfoliants like AHA at 5 to 10% concentration 1 to 2 times weekly to improve texture and cell turnover. Introduce retinol at 0.5% gradually, starting 2 nights per week and increasing as tolerated, and always use moisturizer to buffer irritation. Avoid combining retinol and vitamin C in the same routine to reduce irritation. Instead, alternate them between morning and night or on different days for safer, more consistent results. Support topical care with healthy habits. Drink about 2 liters of water daily and aim for 7 to 9 hours of sleep for skin recovery, as both hydration and rest aid barrier repair and cellular turnover. Assess a new product for at least 6 weeks before deciding it works or causes issues, and stop use immediately if severe redness or burning occurs. See a dermatologist for persistent acne, sudden skin changes, or any suspicious lesions to get diagnosis and targeted prescription options.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.